Welcome to Keep It Kinetic Chiropractic. My name is Dr. Kyle Kopicki, and I'm the owner and chiropractor here of the office. The office is located in Limerick, Pennsylvania. We are off the Saratoga exit of 422. We are in Ridge Pike, and we're less than 1 mile away from the Philadelphia Premium Outlets. My educational background includes Shippensburg University, where I graduated with a bachelor's in science and exercise science, and I had minors in both coaching and biology. And then I got my doctorate of chiropractic from Palmer College of Chiropractic in Florida. I've been practicing in Limerick since 2013, and I'm excited to continue providing services to the community through our amazing office. For those of you who haven't been here before, we wanted to give you a tour of what you can expect when you come in. We're located on the second floor of our beautiful building. It's accessible both through a stairwell and an elevator, so come on in. So when you first come in, the first thing you'll run into is our front desk, where myself and the staff will greet you. We'll introduce ourselves, take your information, and get you started right away. If we ask you to take a seat, we have a few chairs set up for our reception area. I try to do my best to not have a lot of wait time, so I don't expect you to spend too much time here, but this is what the reception area looks like. One of the cool features about our office is our electronic health records. We can do most things through our cloud network where we don't have to use paperwork. So when you come in as a new patient or we do a re-exam, you will get an email from us usually with the paperwork that you can fill out at home. If not, there's multiple options when you come in here. Obviously, if you want to do paper the old school way, we can do that for you. But we have a little station here. If you want to fill it out on your phone while you're sitting in reception, you're more than welcome to. If you want to take the iPad and fill it out in reception, you're more than welcome to. But we also have the iPad set up like a computer. So if you're more comfortable using a mouse and keyboard, we have that option for you as well. So tons of options for you to fill out your paperwork with us. Back here, we have 2 bathrooms. There's a little kitchenette there for myself and the staff. We have some storage here, but there's a water fountain, a hand washing station, which all the patients have access to use on top of the bathrooms. And then after we get you in here and get all your information and get you started for your new patient visit, we'll take you back to the exam room so you can see what that looks like. Our exam room is located back here at the end of our hall. We have 2 chairs in here for you to sit at. We have a TV for when we go over x-rays with patients. This is my computer that I work on. We have digital x-ray, so we can not only take your x-rays, but we can view them immediately once they're taken, and I can go over them with the patient right then and there. I have my exam table here where we do our orthopedic testing. We have a scale here. We take your vitals, we do blood pressure, we check pulse, weight and height, and we also check your oxygen levels. When you come to our office, you can wear whatever you like, but for your new patient visit, a lot of times it's easier if you do wear like sweatpants and a t-shirt. Anything that metal would have to come off if we do x-rays. We do have sweatpants and gowns if we have to get you changed, but wearing the proper attire definitely helps the situation. As you walk out of the exam room and you come down the hall, you'll notice these 2 doors. When I built out this office, I put 3 extra rooms for other providers. And when you open this door here, this is where our massage therapists practice. You can see they're fully set up and ready to go in here. We have a closet for the patients to hang up their clothes. We have a mirror for you to help if you need help putting on your jewelry. The sound machine, they can play music for you. We do CBD massages. They have their own massage lotions, and they make sure you're getting everything you need with your massage. Let's say you're somebody who doesn't like being touched or in a closed room or getting massage. We have some other services over here that I'm really excited about. In my career, I've had experience with these, but until I opened this office, I never had these here before. These are roller massage tables. So these can do similar things that what a massage therapist can do without being in a room, spending 30 minutes to a half hour to 90 minutes. You can do this in about 15 minutes. They're big, heavy roller tables. They have big metal and rubber rollers underneath that go up and down your spine and give you a massage as you're laying there and relaxing. And you can see how we have a dark room, the lights off, we have a curtain up, so you just get to lay in here and relax and have some privacy. Often when patients come to us, they're in pain. And obviously the chiropractic works great for pain relief, but one of the things I like to do before we even start with the adjustment is once you come out of your new patient visit, we'll bring you over here to our therapy area. This is where we do interferential muscle therapy as well as ultrasound for the patient if they need it. Most new patients will need this at least to start, and then some patients like to stick with it long term just because they think it feels great. So this is what the setup looks like. We'll usually lay you face down. If you're not comfortable laying down, we have a chair here so you can sit up. This is all mobile, so we can move it anywhere in here if you need to. We'll usually pair you with some heat, which patients love, but if you don't like that, we can also do cold or we can do nothing. A lot of times that's up to the patient. Let's go over to our adjusting area so I can show you what that looks like. So as you come over here, this is where I work with almost every single patient. This is my adjusting table. I have a couple chairs there if you want a little audience. We have a half wall here too, so people can stand if they'd like to. There's my workstation there, but with what I do, One of the things that really makes me special, just as a chiropractor in general, is I have a bunch of different techniques of how I adjust people. This table does a few techniques on its own. It does some drop work, which some of you might be familiar with, where the table will actually pop up. And then I push down on top of the patient and get a release. Now, the table makes all the noise there. We don't get a lot of the clicks and pops that you expect with some of the other adjustments. That, even though as loud as that was, it's a very light force adjustment that I do with some people. I have some instrument adjusting over here. Call this an arthro stim. This goes around whatever joint I'm working on, usually the areas of spine, and I'll give a little impulse, which this can be used on older people with osteoporosis or kids or babies, but I use this with a lot of patients. Also with most patients, they get both this and the hands-on adjustments. So a lot of times with me, it's almost like you're getting adjusted twice, which is great. Another feature this table does, which is probably one of my favorite things for disc injuries and low back injuries, sciatica, is it does flexion distraction. So what'll happen is the table will start moving. I'll have a handlebar here and I'll hold on to that as the patient's laying face down. I'll put pressure on the patient's back to distract and push up. The table will then push them down and distract that area out, open it up, and that's what allows the joints to move properly. It opens up the disc area, relieves a lot of pressure in there, and helps patients feel really good. One of the most common questions I get asked as a chiropractor is, can I or do I take care of pregnant women? And the answer for me is yes. And a big reason for that is because of this table. This table has an awesome feature in it where the part here where the mother's belly is drops down. This allows the patient to lay face down comfortably. Even before I adjust them, they lay face down, and just that pressure of the belly going down away from their back relieves them. So this is an awesome feature of the table. I've been working on pregnant women my entire career. We get great results with them. It's very healthy and safe for both the mom and the unborn child. And it's another reason why our office is great. On top of the techniques I just spoke about, there's two other techniques I utilize as I work on patients. The first one being this activator. It's another instrument adjuster. This one is a single impulse light force adjustment, similar to what we did with the arthro stim, but this one just does a one individual impulse as we work on the patient. This is great for people who are have a really sensitive condition or are really fragile, such as a baby or someone who's very old and maybe has osteoporosis. So this gets used. I can also use this on jaws and other small areas that I need to get to that my hands might be a little bit too big or too aggressive for. The last technique is the most popular and most asked about. Everyone loves to ask, can you snap my back? Can you crack my neck? Yes, I love doing that. It's the most common adjustment I do. Not everyone likes it, and that's why I have these other techniques. I always tell patients the most important thing you can do with me is dialogue. You let me know if you had a bad experience in the past, or if I did something you didn't like the last adjustment, or if you just would prefer something else. Perfectly fine by me. I will always make my recommendations as to what I think is going to work best for you. But if you feel like it's not working for you or you think we need to switch things up, we talk about it and we change it. And that's why I have all these different techniques and options I have with the tables and my instruments, so that way I can help just about anyone that comes in here. We've talked about the adjustments. We've talked about some of the stim and therapies for when you're in pain. We talked about massage. One of the other things that we do in our office that makes us really unique that not many other offices do is all the rehab work that we have here. We do mechanical traction, we do spinal rehab, we do cervical and thoracic rehab, low back rehab. I have a shoulder rehab program I developed myself that I work specifically with the patients on that's pretty advanced. So let's walk through what some of these things are. So the first thing we'll look at right here is this is one of our cervical traction units. So it's called a posture pump. Patients will lay here for anywhere from 5 to 15 minutes, depending on the severity of their neck. But this is an air sac that the patient has control of that they will blow up and force some extension in the neck. They just lay there to kind of work on some of their neck issues. If you want to look at another traction device that we have, this is our full spine mechanical traction. And what this device does is the patient will literally kneel in this. You see these straps here. They'll kneel here. We'll strap them under their arms. We'll strap them over their hips. We have a part here that straps onto their chest. We lock them into what's called neutral position, and then we allow them to do some neck extensions. So it keeps the spine in a normal neutral posture and allows them to work their neck, which hopefully reinforces that normal positioning that we're looking for. And as we were walking around, you probably noticed some of the exercise balls. We utilize exercise balls with a lot of the programs we do. Over here, we have a mirror. This mirror here is intentional because we want patients to see what they're doing and how they're doing it. One of the things that will make us different from like a physical therapist is physical therapists might have you come 2-3 times a week for, a couple months, 2-3 months in a row. When we do our rehab programs, I try and keep it down to 4 visits. And the main goal for what we do, number 1 is to make you feel better, and number 2 is to be your teacher. Just make sure you learn it, understand it, you do it properly, and then you can do it at home on your own. You don't need to keep coming in here and doing the same thing over and over again, as long as we teach you the right way to do it. Also with our rehab, beyond the traction devices and the balls, we have some mats over here. We will physically get on the floor with you. We can lay them out. If you don't want to lay on the carpet, we can lay them out so you can lay directly on the mat. We have some kettlebells we love to use for our shoulder rehab, and then we have a little rehab ball here. 2 different foam rollers that we love to use. We call this one our full roll and this one our half roll. We also have some broomsticks hanging here for another exercise we love to teach. So now that you got done your appointment with me, you'll head over to the front desk to check out. Probably the first thing that jumps out at you over here is our pillows. This might be our favorite product that we have. We do custom fit pillows. We have both adult sizes and junior kid sizes. We physically measure you for these pillows. They come with a 5-year warranty from the company. They give you a 30-day money-back guarantee, but patients love them. I've been using them for probably about 4 years now. I use them at home myself, and they are great. But as you come over to the front desk, this is where myself and the staff will say goodbye to you for the day. We'll check you out. We'll take your payment. Again, we're electronic, so we can keep your card on file, so you don't have to worry about bringing that in each time. You'll also notice our supplement and product cabinet over here. We have some exercise balls for when we send you home to do them at home. Wedges, which are great for you to sit on, whether you're at your desk or you're driving. When I'm doing x-rays, I always check legs. We have heel lifts here. If you have a leg length discrepancy, we have tons of supplements, ice packs, lots of CBD products, whether you want something for your dog, whether you want some honey for your tea, whether you want some vapor pens. We have the oil, we have some rubs, we have some gummies. We have rock tape, which is another service that I provide, but also you can buy to use at home. And there's just so much more. I just want to say thank you for going on tour with me through our office, and we look forward to seeing you soon.